After nearly 4 weeks of disrupted healthcare services, the Nigerian Association of Resident Doctors has suspended its industrial action. This comes after the signing of a memorandum of understanding between the striking doctors and the federal government. TVC News' Kemi Balogun reports.
It's been 29 days of paralyzed medical services across the country. The Nigerian Association of Resident Doctors has now called off its nationwide strike. This latest shutdown saw about 11,000 resident doctors across 91 federal and state teaching hospitals withdrawing services, leaving many patients stranded and hospitals overstretched.
We have suspended strike.
The suspension of strike follows an extraordinary National Executive Council meeting with NAD saying the strike was halted after the association signed a memorandum of understanding with the federal government.
NEC now looked at it that, okay, not everything, a lot has been done, but not everything has been sorted out. How do we ensure that this is sorted out? In its own wisdom, NEC said, suspend the strike action. Let us give this 4 weeks and see that the political will be translated, will continue in terms of achieving those other things agreed. There's nothing in the MOU signed that extends beyond 1 month. And that is why NEC is looking at that window.
The MOU addressed 7 key conditions laid out by the doctors. 2 of those demands have already been implemented. The remaining 5 items, including the reinstatement of doctors in Lokoja, payment of arrears, upgrades for eligible doctors, a specialist allowance, and issues surrounding the membership certificate, are expected to be resolved within 4 weeks.
The House of Reps committee report that said reinstate the disengaged people in Lokoja. Now there's a Federal Ministry of Health and Social Welfare report recommending that reinstatement too. Even the Ministry of Health report went a step further to say pay them back their entitlements for the period that they were away from work. Now we understand that, as a Federal Ministry of Health, they need to sit down, study the report, and put in mechanisms to implement the report because it is their committee. And that is why when the 2 weeks was brought to the table, we agreed. Let us look at full implementation within 2 weeks. I think it's important that these are some of the considerations that we understand that NEC looked at this to say, let us suspend this strike.
For now, resident doctors will return to their duty posts, restoring essential medical services nationwide, though the possibility of another shutdown still hangs in the balance. Kemi Balogun, TVC News, Abuja.